All right, my name is Chrissy. I will be your nurse practitioner student today, and we are going to complete an assessment of your neurological and musculoskeletal system. Is that okay?
Yep.
What is your name and birthday?
Ashley Cartmine, 7/31/88.
Okay. And do you have any questions before we begin?
No.
Okay. All right, testing cranial nerve 1, olfactory. If you could just close your eyes for me and occlude your right nostril with your hand. And then just smell. Tell me what you smell.
Carrot cake.
Okay, now go ahead and occlude the left.
Carrot cake.
Okay. Cranial nerve 1 is intact. All right. Cranial nerve 2, your optic nerve. Go ahead and open your eyes for me. And you're just going to, that's not my pen light. My pen light. All right. You're just going to follow with just your eyes. Good. Cranial nerve 2 is intact. There is no nystagmus. Cranial nerve 3, 5, and 6, the oculomotor, trochlear, and abducens, we will check together. Just walk straight at me. Pupils are equal, round, reactive to light. They are 3. I'm going to have you stare behind me here. Just look right here at my ear and look right behind me. Good. And I did forget to do the confrontation test for the optic nerve as well. So I'm going to have you cover your left eye. Okay. I'm just going to have you tell me how many fingers I'm holding up.
2. 2. 1.
Good. And opposite? How many?
3. 2. 1.
Good. Okay, your trigeminal nerve, cranial nerve 5. I'm just going to have you bite down with your jaw. Good. And close your eyes for me. Let me get my... Okay. Do you feel this?
Yeah.
Is it sharp or dull?
Dull.
Good. Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Sharp. Sharp. Dull. Dull.
Good. All right, trigeminal nerve is intact. Facial, cranial nerve 7. I'm going to have you close your eyes real tight. Open them real big. Smile. Frown. Puff out your cheeks. Good. Okay. Cranial nerve 8 is the acoustic nerve, and this is just the whisper test, so I'm just going to whisper something. I'll have you close your eyes so that you can't read my lips, and you'll just have to repeat what I say. Red cup.
Red cup.
Good.
Pillow.
Good. All right. Cranial nerve 9, glossopharyngeal. I'm going to have you open real wide and say, ah.
Ah.
Good. The uvula moves up and down. So that is intact. Cranial nerve 10. The patient can swallow and has no hoarse voice. We'll just assess the swallowing again. Go ahead and swallow. Good. And I'm going to have you rotate your head side to side. Good. Up and down. Good. Shrug your shoulders. Cranial nerve 11 is intact. And last one, cranial nerve 12, the hypoglossal. I'm going to have you stick out your tongue, move it side to side, put it inside your mouth, and puff your cheeks again. Good. All right, all cranial nerves are intact. All right, to evaluate your coordination, I'm going to have you just take your hands on your thighs and move them up and down really fast. Good. And then I'm going to have you follow, finger to nose. And have you touch my finger with your index finger and then touch your nose really quick. Good. Okay, no tremor. All right, we're going to have you stand up here. I'm going to assess your balance. So stand hip width apart with your arms crossed across your chest. And we're just going to stand here for 30 seconds. I don't note any swaying. Now go ahead and close your eyes. Good. Balance is good with the Romberg test. I'm going to have you walk heel to toe towards me. And back. And then you can sit back down. Perfect. No ataxia. She's a normal gait. I'm going to have you take your heel and just run it down your shin on the opposite leg. Run it up and down. And the other side. Perfect. All right, again, back to the sharp and dull objects for sensory. Close your eyes for me. I'm going to touch various objects or portions of your body, not just your face this time, okay? And you just have to tell me if it's sharp or dull and where I'm touching you at.
Sharp in my face.
What side of your face?
Right.
Good.
Dull left arm. Sharp left arm. Sharp right arm. Dull right arm. Sharp left thigh. Sharp right leg. Dull right thigh. Dull left leg.
Good. Sensation intact, as well as the perception of position. I'm going to have you keep your eyes closed. I'm going to place an object in your hand. If you want to put out one of your hands and you just tell me what it is.
Pen.
Good. Keep that hand out for me. I'm going to draw a letter, and you just have to tell me what letter that is.
An O.
One more time.
O-C.
Perfect. We already identified the body area. I guess I did forget to do the toes, though. Let's see if we can.
Dull toes. Sharp toes.
And your other foot.
Sharp toes. And dull toes.
Beautiful. Keep your eyes closed. I'm going to touch you with 1 or 2 fingertips, and you'll just have to tell me how many.
1. 1. 2. 2. 1. 1. 1. 2. 2. 1.
Good. Okay. And moving on to our reflexes. I did assess abdominal reflexes during the abdominal exam last week, so we're not going to do that today. Go ahead and keep your feet out of your slippers for me. And I'm just going to check Babinski here. You're good. Tickle?
Yeah.
All right, Babinski is negative. We will attempt to do our deep tendon reflexes here. So bicep, brachioradialis, our patient does not have good reflexes. Go ahead and bend this into an L.
Clearly, I don't know.
And just relax. Tricep. And that's at the posterior elbow if you can't see that. And then patellar, just relax, just below the kneecap. Relax again. And patellar, or Achilles. And then ankle clonus. Just going to plantar flex and dorsiflex repeatedly a few times. Sharply dorsiflex, and then look for jerking. I had 2 jerks after that. So that would be negative. And just 1. So ankle clonus is negative. Moving on to the musculoskeletal system. Are you having any pain anywhere?
No.
Okay. Shoulders appear symmetrical. Head is aligned. I don't see any shortening or rotation. No deformities. Palpating over the upper extremities. Do you have any pain anywhere?
No.
No crepitus. No pain. No masses. I'm going to have you go ahead and just bend your arm, either both at the same time or separately. Any pain with that?
No.
Go ahead and move forward. Any pain with that?
No.
Go ahead and move your knee up and down. Any pain with that? What about, can you move it side to side? Any pain with that?
No.
I'm going to take your leg and I'm going to bend it. Any pain at your hip?
Nope.
Nothing there either?
Nope.
Okay. If you want to stand up for me and turn around, and we will just check. Oop, that work. Any pain when I'm pushing anywhere?
Nope.
There's no pain, no tenderness, no step-offs or deformity of the cervical, lumbar, thoracic, or sacral spine. Anything else bothering today, or anything that you would like to talk about?
Nope.
Okay. Negative musculoskeletal exam. Thank you.